Imagine watching your child take a breath. Then suddenly, they can't. For centuries, parents feared a disease that could turn an ordinary cough into a terrifying struggle for air. The child would cough again, and again, and again. Then came the sound doctors could never forget, a desperate gasp for breath. This was whooping cough. But how did a simple-looking cough become one of history's most dangerous childhood diseases? And more importantly, how did humanity finally learn to stop it? Before vaccines, childhood illnesses were not just minor sicknesses. They could change a family's life forever. One of the most frightening was whooping cough, also known as pertussis. The disease begins deceptively. A child may seem to have nothing more than a runny nose, mild fever, and an ordinary cough. But then, the coughing intensifies. One coughing attack can trigger another, and another, until the child struggles to breathe. After a series of violent coughs, the child may suddenly gasp for air. That distinctive gasp became the reason the disease was called whooping cough. But the terrifying part was not just the sound. It was what happened inside the body. The infection attacks the respiratory system and can cause prolonged coughing fits. For babies especially, the danger can be severe. Some may stop breathing altogether. And centuries ago, doctors had very few tools to help. There were no modern antibiotics, no effective vaccine, no intensive care units, and no clear understanding of what was causing the disease. So families often had to watch helplessly as children became weaker with every coughing attack. Then, in the 20th century, scientists began getting closer to the real enemy. They identified the bacterium responsible, Bordetella pertussis. That discovery changed the fight. Scientists could finally study the organism responsible for the disease and understand how it spread. But identifying the enemy wasn't enough. The real breakthrough was prevention. Researchers developed vaccines against pertussis, and vaccination programs dramatically reduced the number of cases and deaths. A disease that had once terrified parents could finally be controlled. But there was a twist. Whooping cough never completely disappeared. The bacterium continued circulating, and because immunity can decrease over time, outbreaks can still occur. That is why vaccination and public health surveillance remain important today. The story of whooping cough is more than the story of a dangerous cough. It is a story about how medicine transformed childhood. A disease that once began with something that looked harmless, a simple cough, could become a fight for every breath. And humanity eventually learned something powerful. Sometimes the greatest medical victories don't come from defeating a disease completely. They come from making sure fewer people ever have to fear it in the first place.